Hello guys, welcome back to my channel. It's me again. Welcome back to Edu Scholar Attainable. I am Dr. Samadila. So today I'll be talking about different countries where you can go and practice medicine as a doctor. And as I'm mentioning these countries, I'll also be talking some of the exams that you have to write in order to be eligible to work in any of these countries. Yeah. I know a lot of people go to different countries to work as a doctor for various reasons. Some people, their reason is just because they want to migrate. Some people, it's because of better pay. Some people, it's because of better working environment, better working equipment. Whatever your reason is, I'm here to help you, to choose some countries where you can actually go and practice medicine and surgery. Yeah. So the first country on my list is Russia. I don't know why I decided to start with Russia, but Russia is a country where I studied medicine and they are very dear to my heart. In fact, I love Russia. So after studying medicine in Russia and you want to stay back in Russia and practice, you have to do what we call ordinatura. So you can start to do ordinatura in surgery or in cardiology or in pulmonology or in internal medicine or in neurosurgery. Any specialty you want to go into, you can just directly go into it. The thing is, to do this residency or ordinatura in Russia, you have to pay school fees. Yeah, I know. You have to pay school fees. So mostly you do the ordinatura for 2 years, and within these 2 years, you're expected to pay tuition fee. I don't know the idea about this, but they see it as they are explaining things for you and all of that. So because they are teaching you how to take care of patients, how to practice medicine in Russia, so they see it as you have to pay school fees. I do not like it, because why would I spend 6 years in med school in order to come out and start working to earn money, only for me to come and do one residency where I have to pay school fees? So it doesn't make sense. But then there is government scholarships. So most Russian citizens that graduate from med school, they're able to get a government scholarship. So when they get it, they can enter into ordinatura for free. But then people that are not able to get this scholarship, they will have to pay for the tuition, which I feel is unfair. Honestly, Russia has to look into that, because I feel it's very unfair. Honestly, it's very unfair. So after these 2 years of ordinatura, you have to do another 3 years in PhD. So let's say you did 2 years in surgery, right? You have to do 3 years in PhD surgery. So at the end of the day, it's 5 years. But then some people, they just do ordinatura for 2 years, start working for a while, make money. Maybe after some years, they can go back to do PhD. But some people, they just do the 2 years and just start working to get the remaining experience, and they don't go back for the PhD. So it's up to you. Yeah. And most of them, especially those that don't get scholarship for their ordinatura, they can do this thing. They can be doing the ordinatura and then be working part-time, maybe as a therapist. They call it therapist in polyclinica. So you can be working part-time in polyclinica and be making money. You still be working as a doctor and be making money. Or if you decide not to work as a doctor, you can be working part-time in any other place to be making money while you are still doing your ordinatura. Yeah. So it works for a lot of people. After that 2 years, you can now come out, write the board exam. Once you pass the board exam, you are now qualified to look for jobs. Once you get a job, you can start working. The pay is quite decent here. So Russia is actually an option. But the only thing is that people that didn't study in Russia, doing residency in Russia might be a bit challenging because of the language. If you don't know the language, you might not want to do your residency in Russia. And then if you don't get a scholarship, you might not want to pay school fees for residency. Yeah. So that is why it's very limited for so many people. So at the end of the day, it's just Russians that do residency in Russia, and then people that studied in Russia that do residency in Russia. Yeah. The second country on my list is United States of America, of course, the big USA. So for USA, in order for you to work as a medical doctor in USA, you have to do series of exams. I feel like USMLE is one of the hardest exams that ever exist. I might be wrong, but I'm just saying. Well, so there are 3 steps to these exams. You have USMLE Step 1, you have USMLE Step 2, you have USMLE Step 3. Now, this Step 1, USMLE Step 1, involves basic sciences like pharmacology, microbiology, immunology, biochemistry, and then some basic systematic courses in cardiology, pulmonology, and all of it. Yeah, I even forgot psychiatry, and then biostatistics. Yeah, so most people can actually write USMLE Step 1 while they are still in medical school. So let's say you are done with 4th year of medical school, you should be able to read for USMLE Step 1 and write it. Yeah. For the exam is quite difficult. So I wouldn't say difficult, it's quite complex. So I recommend that you make sure you are very prepared before you go for the exam to avoid any sort of failure. But then if you fail, you can always write again. Yeah. For the USMLE Step 2, that one is clinical skills. So here they are going to test your clinical knowledge, and this involves surgery, pediatrics, internal medicine, obstetrics and gynecology. They also added psychiatry and then biostatistics. Yeah. I feel like for this clinical knowledge, if you can do internship in a hospital first before reading for USMLE Step 2, it will help you a lot. So let's say you are done with 5th year, 6th year, and then you want to write your USMLE Step 2. If you can go to a hospital and just shadow some doctors, like rotate through the hospital, like do pediatrics, do surgery, do internal medicine, do obstetrics and gynecology. So see different cases at different intervals. I feel like when you see all these cases and then you are reading for your Step 2, it's going to make more sense. But then if you don't have any form of clinical knowledge in the hospital and then you are reading for Step 2, it might be more difficult for you to understand. I'm not saying it is not doable, it is doable, but just that it might be more difficult for you to understand. So if you can do some clinical rotations in the hospital or internship in a hospital while you are reading for Step 2 or before reading for Step 2, it will help you a lot to make the understanding better, and then your probability of passing at your first instance will be higher. Yeah. And then in between USMLE Step 2 and USMLE Step 3, there is something we call pathway and then OET. For OET, you just have to read for it. 1 month is enough for you to prepare for OET. So you read for your OET and make sure you get at least grade B in all of the sections: reading, writing, listening, and speaking. Why the pathway? We have pathway 1, 2, 3, 4, 5, 6, right? So a lot of people are not eligible for pathway 2, 4, and 5. But then most international graduates or medical students are eligible for pathway 1, pathway 3, and pathway 6. So for pathway 3, your school has to be in World Federation of Medical Education. Once your school is there, you can use pathway 3 to get your ECFMG certificate. But if your school is not in WFME, but then you have a license of another country. Let's say you're from Nigeria and you've done your 1 year internship in Nigeria and you have your full license from Nigeria. You can use Pathway 1. Pathway 1 is for people that already have full license. Why Pathway 6 is for people that doesn't qualify for Pathway 1 to 5. So you can use Pathway 6. You just have to get 3 or 6 doctors to do mini clerks examination for you. They will have to rate you and grade you and send the grading to ECFMG. Once that is done, you will now get your ECFMD certificate. So after getting your ECFMD certificate, you can decide to apply for residency, or you can decide to do your step 3. So which other comes first? You can do your step 3 before applying for March, or you can just apply for March. When you March and you're already in USMLE, and you're already in the United States, then you can now do step 3. For a lot of international medical graduates, they don't get to write step 3 for various reasons, maybe because of money, because of lack of visa, and a whole lot of things. Yeah. So if getting a visa is going to be you should just try to March. But if you have visa and you have the money, why not just go to USA and write step 3 before trying to March? So yeah. And the matching process can be very, very competitive. So you can try to match the first time and no match. Try again the second time and no match. Some people match at the third time, some people at the first time, some people at their second time. So it depends. And then I forgot to add US clinical experience. So if you can get US clinical experience in the US, is also going to help you boost your CV. If you can do online US clinical experience, that's telerotation, it can also help you in some specialty like internal medicine and family medicine. I don't know about surgery. I don't think telerotation can help you in surgery, because surgery is more of hands-on. You have to be doing this stuff. Yeah. What else did I miss? Okay. Then for your CV, you can make your CV top notch. Yeah. If you can get clinical experience in your home country, is perfect. If you can get clinical experience in USA, is also good. Just try to have clinical experience before applying for March. And then I forgot publications. Oh God, don't even joke with that one. Like, you need to have at least 1 or 2 publications. In fact, the more publications you have, the better. So if you can start writing some articles, maybe joining groups, start writing articles, or even writing articles on your own without having to join any group, good. So just write articles and add them to your CV, just to make your CV top notch. Like, nowadays, the programs, that's the hospitals you're applying to, they don't look at scores. They don't look at only scores anymore. They also look at other things like your academic prowess, your publications, your CV, your volunteer work, internships. All these things, they all matter. So if you can make your CV very nice, that will help. Look at me talking as if I'm actually the US. Please, I am not there. I'm just talking because I have so much experience about it, and I'm here to put it through because I love all of you, Yeah. So the third country I am going to talk about is UK. I feel like a lot of people know much about UK, but whatever, in case you know or you don't know, I'm still going to put you through. So for UK, they have what we call PLAB. Well, now they have changed it to UKMLA. I don't even know why they did that. Like, what's the difference? PLAB, UKMLA. Anyways, whatever. So before you write PLAB 1 or UKMLA 1, you have to first do your IELTS, get some certain scores. I think you have to get 7.0 or 7.5 thereabouts. I'll have to cross-check, or you can cross-check on the GMC website. So you can cross-check and know the exact IELTS score. I think it's either 7.0 or 7.5 in each of the sections: listening, writing, reading, and speaking. You can decide to use IELTS, or you can decide to use OET. So for OET, you just have to get grade B in each of the sections here. So once you have certified your English proficiency, then you can now go ahead and book PLAB. Oh, why am I still calling it PLAB? Please, UKMLA. You can go ahead and book your UKMLA. There are so many places where you can write the exam. You can write the exam in Nigeria, Ghana, UK, USA, Canada, like so many places. You just have to look for a location that is closer to you. Then you can book and then write the exam. I feel like UKMLA is not that difficult. Just read with the right material. I think they have Plabable. You can read Plabable, and there is also another one. Forgotten the name, but I know Plabable is more valid. Like most people use Plabable. So after reading for it, you can do the mock. Once you're passing the mock, go ahead and write your UKMLA, and hopefully you pass. And then your UKMLA exam is going to last for 2 years. So within that 2 years, you are expected to do your PLAB 2 or your UKMLA 2. So this PLAB 2, you can only write it in the UK. So this means you have to get UK visiting visa to go write your PLAB 2. So you book the exam, and then you go to UK, you write the exam. The PLAB 2 is more of orals, clinicals, yeah. So you write the exam. Once you pass, you now apply for GMC certificate. So in order to apply for GM certificate, you need your IELTS or the OET, you need PLAB 1, you need PLAB 2, and then you need 1 year of internship, medical internship in your home country or any other place. So once you provide all these documents, you send it to GMC. Once they go through it, then they can give you the GMC full license. This one is just for you to be able to get a work and do your foundation year 2. But in case you don't want to do foundation year 2, foundation year 2 is just a non-training job, meaning you are just working as a medical officer. You are not training to become a specialist. But if you want to train to become a specialist, after writing that PLAB 2 and getting GMC, you can write what they call ZMRSA or whatever they call it. If you write down one and you pass, then you can start looking for how to get residency spot. But the thing about UK is that their residency spot is now hard to get nowadays because of some new laws in the UK. Yeah, so you might end up just doing medical officer job for a very long time before you get a residency spot, whichever works. I mean, it's not everybody that will become a specialist. Some people just become medical officer for the rest of their life, while some people will become specialists in surgery, in cardiology, cardiothoracic surgery, neurosurgery, pulmonology, internal medicine, general practitioners, family medicine, all these things. Yeah, I still have other countries on my list, but I don't want this video to be so long. You know, when it's so long, people might not want to watch. So I decided to cut it short. I'll be making a second video. Yeah. Anyways, if this is your first time coming to my channel, try and subscribe. Send this video to people that you think might need it. Yeah. Well, this video is for every medical doctor, every medical student, and upcoming medical doctors. The earlier you start preparing for your future, the better. Love you. See you on my next video. Bye.